Do all women need testosterone? Halle Berry just announced she's on testosterone. Kate Winslet is also on testosterone therapy, and they look amazing. There's no FDA-approved testosterone for women in the United States, despite global consensus that it works for low libido. Meanwhile, men get testosterone approved after 6-month studies. Women, we've spent $1 billion over 5 years proving it's safe, and the FDA still said no. Hey, I'm Dr. Rajka, your functional medicine MD. In the next 10 minutes, I'm going to reveal the truth about testosterone for women, who actually needs it, and why the system is failing us. Let's start with what's actually happening to your testosterone as you age. Testosterone decline isn't a menopause thing. It's an age-related decline that starts in your 30s. Studies show that bioavailable testosterone, the testosterone your body can actually use, declines linearly starting between the ages of 30 and 40. And by the time you reach perimenopause, you've already been losing testosterone for 10 to 20 years. But here's where it gets interesting. Total testosterone levels do not drop significantly at menopause itself. This is an age-related decline, not a sudden menopausal crash like estrogen. And there's another problem, birth control pills. Birth control suppresses your ovaries and adds back in synthetic estrogen and progesterone in the form of progesterone, but not testosterone. Worse, birth control dramatically increases sex hormone binding globulin, which binds to testosterone and makes it inactive. Your free testosterone crashes, and it can take months to recover after you stop the pill, which is commonly given to women in perimenopause. So we've been suppressing women's testosterone for decades through hormonal contraception, and nobody talks about it. Here's a biologic fact. Your libido naturally peaks around ovulation. Why? Because that's when your testosterone peaks. It's nature's way of saying, let's make a baby. Without adequate testosterone, that natural drive disappears. Testosterone receptors are found throughout a woman's entire body, in the brain, muscles, bones, and throughout the genitourinary system. This alone should tell us something important. Testosterone is not a libido-only hormone. Let's be clear about the current state of the research. The only officially recognized indication for testosterone therapy in women is for postmenopausal women with hypoactive sexual desire disorder, meaning persistently low libido, that causes distress after other causes have been ruled out. That's the only indication that's been studied rigorously enough to meet the formal guideline criteria, despite that there's global consensus that testosterone improves libido, with some emerging data in perimenopausal women as well. But here's the critical distinction. The absence of evidence is not the same of evidence of absence. Guidelines don't say testosterone only helps libido. They say libido is the only outcome that has been studied well enough to definitively prove. We don't have yet large enough randomized control trials evaluating testosterone for energy, cognition, mood, muscle mass, bone health, or overall vitality, but that doesn't mean it doesn't help. It means the studies haven't been done. Did you know that less than 10% of research is done in women? And they haven't been done because there's a little financial incentive. Testosterone for women is not FDA approved, so pharmaceutical companies are not funding large trials. Meanwhile, this is what I've heard repeatedly over 31 years within my clinical practice. I feel like myself again. I didn't realize how badly I felt. That was the missing piece all along. Women on physiologic doses of testosterone commonly report more energy and motivation, improved mental clarity, better ability to maintain and build muscle, improved mood and sense of self, less joint pain and stiffness. Does this matter? Absolutely. Quality of life matters. Is this anecdotal? Well, yes. Do I have thousands of patient years of clinical experience supporting it? Absolutely, I do. Medicine is both art and science. The science clearly supports testosterone for libido. Clinical experience, including my own and that of many functional medicine doctors and doctors in general, suggests the benefits extend well beyond that. Your body doesn't read guidelines, and if you're struggling with fatigue, brain fog, loss of strength, or loss of vitality, testosterone is a missing piece that allows you to feel like yourself again. That is not nothing. It's time for the research to catch up with what clinicians have been saying for decades and seeing for decades. Now let's talk about why there's no FDA-approved testosterone for women in the United States. So a pharmaceutical company spent $1 billion in 5 years saying it was safe for low libido. And then the FDA came back and said, well, women have breast tissue, so we need 5 more years and another $1 billion to study breast cancer risk. Every company said, we're out. Who's gonna spend $1 billion? Meanwhile, men get testosterone approved with only 6-month studies. The goalpost keeps moving for women's health, and it's absolutely unacceptable. So here we are, global consensus, it works. Decades of clinical experience say it works, and studies show it's safe in the short term, but there's no FDA approval. That leaves women and their doctors in a frustrating position, because if a postmenopausal woman with low libido that's causing you distress, you may get testosterone, but otherwise, you may not. Remember what I said all along? This Women's Health Initiative damned all women off of hormones for over 2 decades. So do all women need testosterone? In my humble opinion, yes, but that's a conversation you need to have with your doctor. You may be a candidate whether you're in perimenopause or postmenopause or not at all. If you're experiencing persistently low libido, that doesn't improve after addressing relationship issues, stress and mental health issues, medication side effects like from SSRIs, sleep quality, and evaluating adequate estrogen and progesterone level. This last point is critical. You have to optimize estrogen and progesterone first. Testosterone isn't a first-line treatment unless your progesterone and estrogen are already normal. Other symptoms that might improve, although the evidence is weaker, include mood changes, particularly feeling not like yourself, difficulty maintaining muscle mass despite resistance training, fatigue despite adequate sleep. But again, the strongest evidence is for low libido. Now here's the challenge. Defining normal testosterone levels in women is complicated. For premenopausal women, total testosterone typically ranges from 50 to 57 nanograms per deciliter. Of course, I prefer the upper 75th percentile, but there's a natural variation throughout your cycle and across different ages. What matters more than the number is how you feel, whether your levels have dropped from your baseline, whether other causes have been ruled out, and what your free testosterone level is. You need a comprehensive assessment, not just a single blood test. If you're a candidate for testosterone, here's what you need to know. While there may not be an FDA-approved testosterone for women, doctors have several options. Option 1 is to use male testosterone products at lower doses. This is not my preferred option, but this is what most allopathic doctors do. You would use a fraction of the dose that is FDA approved for men. Like, the downside, these gels are potent and come out of a tube, making precise dosing difficult. A little too much and you're getting side effects. A little too little and you're not getting the benefit. Option 2 would be compounded testosterone cream. And this is my personal preference, though I need to be transparent about the controversy. The global consensus recommends against compounded testosterone. They say it's due to lack of standardization, uncertain absorption, and potential for overdose. But here's my clinical experience. Compounded creams allow for precise dosing at strengths appropriate for women. I can titrate this up or down to whatever my patient needs and adjust based on her response. I also personally measure levels. I also want to dispel the myth that compounding pharmacies are not FDA regulated. Here's the truth. Compounded medications are not FDA approved products. However, compounding pharmacies are most certainly regulated by states' boards of pharmacies, and they are subject to FDA oversight inspections. And of course, actions are enforced when standards are not met. I've had excellent results by using trusted pharmacy and regularly monitoring my patients, both via testing and via symptom. It took 20 years to remove the unfounded black box warning on estrogen. Hopefully it won't take 20 more years to get FDA approved testosterone for women in a variety of strains. Until then, I'm working with the tools I have, and compounded creams give me precision. Here are some application tips. You want to apply testosterone cream to areas where hair growth may not be a big deal if it were to occur. Your lower abdomen, your bum, your inner thighs, maybe your inner forearms, and you want to rotate sides and rub it in completely. Of course, avoid the genitals directly. The absorption may be variable. The other options would be injectable and pellet options. Some doctors use testosterone pellets. These are inserted under the skin. I don't recommend pellets because you get super physiologic levels, particularly in the beginning, way higher than normal. And if you have any side effects, I can't remove them. You're stuck for 3 to 6 months. In my humble opinion, topical applications are safer and more controllable. And testosterone takes time to work. I tell patients it may be a couple months, maybe even 3, before you notice real benefits. Although some women experience benefits right away within the first month. You may wake up one day and think, wow, I just did a head turn when someone attractive walked by. Or I actually was interested in initiating sex with my partner. The most common side effects with physiologic doses, these are doses that would mimic what your body would naturally make, are mild acne. This is dose dependent. I rarely see it if the dosing is correct for that individual woman. Increased hair growth. You may have to shave your legs more frequently, but most women don't complain about this either. Again, these are manageable and dose dependent. And at physiologic doses, you won't get a deep voice, facial hair, masculine features, or muscle bulging. Look at Halle Berry and Kate Winslet. They're on testosterone and look amazing. Here's the honest truth. While we may not have long-term safety data on testosterone, the short-term studies show it's safe at physiologic doses. The choice for testosterone therapy is a shared decision between you and your doctor. The short-term data is reassuring. So, do all women need testosterone in menopause or before? Some would argue no, but I would argue that all who have declining levels and or symptoms could benefit, especially postmenopausal women with low libido. Unfortunately, less than 4% of women are on any hormone therapy right now. That's worse than 10 years ago. The system is failing us. Women deserve FDA-approved formulations designed for our bodies. Access to evidence-based treatments and studies. The same urgency men get when studying their hormones. We are more than our breast tissue. We deserve to feel like ourselves again. Here's what you can do. Track your symptoms, libido, energy, mood, compared to how you felt a year ago, 5 years ago, 10 years ago. Rule out other causes. Is your relationship under stress? Are you stressed out in general? Are you on any medications? How is your sleep? Make sure your estrogen and progesterone are optimized first. Get your testosterone checked. Ask for a sensitive assay. Your doctor should know what this means. And then find a provider who understands testosterone prescribing for women. You can visit ifm.org to find doctors trained in functional and integrative medicine who specialize in women's hormone replacement therapy. If this opened your eyes to the testosterone truth, subscribe for more evidence-based content about women's health. I'm fighting to bring this information out of the shadows and into mainstream medicine. Drop a comment. Have you tried testosterone? Are you considering it? What questions do you have? Watch my complete guide to hormone replacement therapy, or check out my deep dive into why the Women's Health Initiative was so catastrophically misinterpreted. Remember, you deserve answers, you deserve options, and testosterone might be the missing piece of your menopause puzzle. I'm Dr. Rajka, and I'll see you in the next video.